Welcome to the legislative update for the week ending Friday, May 7th. My name is Colleen Patterson, and I'm the Director of Employer Services and Compliance at Savoy. We continue to patiently await additional guidance from the DOL, or even the IRS for that matter, regarding ARPA COBRA subsidies. In the meantime, there has been some news with the New Jersey Department of Banking and Insurance, as we all know, that's called DOBI. So DOBI recently held a special SEH meeting last week to discuss the ARPA COBRA subsidy. Nothing has been decided yet regarding New Jersey state continuation and whether or not they will permit assistance eligible individuals who waived or dropped coverage to be eligible for the subsidy. However, as DOBI examined the law more closely, they found that the DOL incorrectly assumed that when state continuation applies, the qualified beneficiary pays the premium directly to the carrier. As we all know, that's not correct. So the qualified beneficiary actually pays the employer, and then the employer pays the carrier. That's the way that it really works. So what this means is that the DOL's assumption for state continuation that the carrier will absorb the premium and be entitled to the credit is not correct. Therefore, New Jersey DOBI is awaiting guidance from the DOL on this issue, and they hope to have it before May 31st. So definitely stay tuned. Moving along, though, there's additional information regarding self-insured state continuation, and there's been some clarifications made. Aetna AFA's legal and compliance team have determined that since state continuation does not apply to self-insured plans, and the federal guidance specifically indicates that self-funded groups who are under 20 and are state continuation are not eligible for the subsidy. Therefore, Aetna AFA will not be offering the ARPA subsidy, even though Aetna AFA allows employers of these groups to offer state continuation. So that's huge news, that clarification. Other carrier news, so just to clarify, for United Healthcare, Oxford, and Cigna, all of them have already stated that they do not permit state continuation to be offered. Therefore, there's no subsidy to apply. So moving on, the IRS recently provided reminders about Pcori fees, and they also released an updated Form 720, which, as a reminder, this is the form that's used for filing Pcori fees. Just to go over a few facts about Pcori, believe it or not, it's right around the corner. So 2020 Pcori fees will be due on or before July 31st, 2021. For plan years ending between October 1st, 2020 and September 30th, 2021, the fee is $2.54 per covered life. For plans ending October 1st, 2021, and after, the fee is $2.66 per covered life. The Internal Revenue Service recently released an updated Form 720, and it does reflect all of these changes, and it does have on there the new fees for the current year. And the fee is in Part 2, line 133 of the form, which I believe is different than years prior. Next, the Department of Labor, Health and Human Services, and the Treasury, which, as we know, we all call them the departments, released frequently asked questions at the end of last week to provide guidance for the mental health parity comparative analysis requirement that went into effect on February 10th, 2021. The FAQs confirmed that group health plans that are subject to mental health parity rules should now be prepared to make the analysis available upon request by federal or state agencies, or for plans subject to ERISA. So that means if plan participants ask for it, it's got to be ready. In addition, the FAQs point to the steps in the DOL self-compliance tool as a guide for what is expected to be included in the analysis. Insurance carriers will handle the analysis requirement for fully insured plans. However, employers offering self-funded group health plans need to be taking steps to comply with this new mandate. Most group health plans offering mental health and/or substance use disorder benefits are subject to the mental health parity rules and are therefore required to provide such benefits in parity with medical surgical benefits, and are now also required to prepare a comparative analysis documenting compliance for any quantitative treatment limitations. The analysis does not need to be submitted annually, but instead is completed and it's kept up to date in the employer's files, and it has to be provided if requested. So for example, if it's by a federal agency or a state agency, and as I mentioned, if any plan participants request to see that. If the comparative analysis is requested, but it's found to be insufficient or can't even be presented, then there is actually some corrective action that can be taken within 45 days. But if the plan fails to comply with the suggested corrective action plan in a timely manner, the agencies will notify enrolled individuals of the non-compliance and may also include the plan in a public report along with other non-compliant plans. So they definitely are taking non-compliance very seriously. So I wanted to mention today, because this has been getting a lot of attention, the Blue Cross Blue Shield settlement. So this topic has been probably one of the biggest topics of the last week, in addition to ARPA. But with attention always comes lots of questions. So I wanted to share with everyone that we will be releasing a special edition podcast this week, breaking down what you need to know and addressing the most frequently asked questions. So definitely keep an eye out for that link. This concludes our update for this week. As always, should you have any questions, please reach out to your dedicated Savoy team and continue to use the resources available on our website at savoyassociates.com. From all of us at Savoy, stay healthy and safe. Thank you for joining us today.